And welcome back. We're continuing this discussion on the national health insurance. And let me go to Professor Mokgokong on this one with regard to the funding. Now, there's quite a bit, again, of concern around the matter of funding, not only who, where, and how will it be administered, but also just in terms of, if we look at what's currently happening, the majority of funding actually goes towards salaries and not really towards services and towards medication and other resources. So how is this going to be safeguarded against going forward in NHI?
Thank you very much. Before I answer that, there's an issue I really need to clarify about the inefficiencies, saying how can things improve when there are so much inefficiencies. I don't think the public should have, an impression that healthcare services are the worst run services of a department. Of course, the whole country is suffering. Of course, the whole ship appears to be sinking. And when it starts to sink, even the well-operating, platforms will have water coming into them. So no, we mustn't have that. I think we are in a situation, we are the people who actually provide that healthcare on the ground, as we are indeed in the public system. So yes, inefficiencies are there, but as we save the entire ship from sinking, all platform will be dry. Now, coming to the issue of funding, of course, the responsibility of funding of healthcare rests in the shoulders of governments. That's all over the world, the UK, Canada, USA, and so on. So yes, I do envisage that our fiscus, the most of it, I do envisage, because things haven't been worked out properly. But I do envisage that, the Department of Revenue or Department of Finance is going to inject. I am aware that there would be other funding that people think of. And the issue that we raised earlier, that what about people who want their own? Nobody is stopping them from doing their own. Even people without medical aids who have cash, nobody is going to stop them. According to the bill, they will be allowed to do whatever extra they want to do, but we must cover the universal health care of everybody, the haves and the have-nots. You can top it up if you can. Nobody will stop you from doing that.
And then just coming to the issue of what's currently happening yet again, because I think in principle, most people would agree with NHI and what it proposes to do. However, when people look at what's happening in practice, this is where the concern comes in, Ms. Madumo Gova, because Brufen and Panado to cure everything in the public healthcare system, that's what people will tell you. And surely people are scared that when they walk into a hospital, they even tell you, sometimes you're scared you're not going to come back. So shouldn't we be starting there with fixing the system as it is? Or is this going to give us sufficient time to do just that?
I think the most scary thing is not even having a choice. Not having a choice where you need to go because you can't afford it. Not having a choice where your child needs to get surgery when you so need it and the queues are very long to save your own child. That is very scary. You see, we, as a country, we've been catering for long for the haves. We've been catering for long for those people who say, but I've got the money, I can afford it. And we have left out those who can't. And we have left our own people to die because they can't. So for me, that argument doesn't really hold water. What is important is that we need to ensure that every citizen of our country gets equal quality health care. And yes, this, pool of funding that's going to go, yes, the concerns are there. Administratively, it won't be great. Our hospitals are in shambles. We don't have good staffing ratios. But this is exactly what this is intending to correct. If we don't start now, we will be singing the same song in the next 100 years. We can't wait any longer. It needs to set in. Every one of us in this country must get quality health care.
And again, I think many few people will argue with that. But Professor, perhaps your parting shot for us on this matter going forward, and perhaps in trying to allay the fears of people who feel that this is another mess waiting to happen.
Yes, I'm happy you commented that nobody can be against such a system. That's why many of us are surprised that Donald Trump is trying to destroy the Obamacare, which is in fact along the lines of the national health system. The whole world is going that way. The United Kingdom, Britain, has been with the national health services for many, many years. Yes, there will be problems, but problems as they come, they will be resolved. I'll refer you back to the early problems that the national health services in Britain had. Exactly what we're facing, that people cross the borders and put a lot of burden on that system. And in fact, then they decided we must look at the citizenry as one of the ways of controlling this. So we've had all these debates with them, and we know where to patch. We don't want to reinvent the wheel, but it's a good will going forward.
Well, that's where we're going to have to leave it, and many more questions remain. I'm sure the doctors will weigh in, the medical aid schemes will weigh in. The doctors say they're not making the monies, it's the funds that are making the money. Funds say no, it's the administrators who are making the money. So much more to come still on this particular issue of the national health insurance. But thanks to our guests this morning, and of course, we are awaiting your response on our question of the day, which relates to this as well. Let's go to a break.